Welcome back to SA Live. Well, our children and teens are facing a national mental health crisis. Depression was already on the rise, and the pandemic just made feelings of pressure, anxiety, and isolation worse for kids and their families. Joining us today with the signs to look out for is Dr. Dina Tom, pediatric hospitalist with University Health and Associate Professor of Pediatrics with UT Health. Welcome, welcome.
Thank you.
All right, let's talk about why pediatricians and mental health professionals are calling this a national child mental health crisis.
So it's a great question. Prior to COVID, about 1 in 5 children were experiencing a mental health issue, and a very small percentage of those kids were getting help. So as you know, and I know, that COVID brought with it a lot of uncertainty, fear, grief, anxiety, isolation for everyone, but especially for children. So, we're seeing these rates of depression and suicidation just skyrocket, and I'm seeing that as a hospitalist. In the hospital, we're taking care of a lot more children who are hospitalized for severe health issues.
So what are some of the signs that a child or teen might be going through a mental health crisis?
Yeah, so, there are some persistent signs, sometimes persistent sadness, specifically if they've lost a loved one. About 1 in 4 children have lost a parent or grandparent to COVID, which is devastating. Right. So if you're noticing that your child's experiencing severe sadness for more than about 2 weeks, if they are isolating themselves more, if they're having poor personal hygiene, if they are having emotional outbursts, behavioral outbursts, those are signs that are concerning. So it's always good to talk to your pediatrician if you're seeing that.
So if those signs have been noticed, what steps should parents or caregivers take?
Yeah, so I think the first thing is really making sure that your child knows that those things can be normal. We all experience those things, and so sitting down with your child and letting them know that it's normal to feel very sad, it's normal to feel scared. But if you're really noticing that your child's doing things that are concerning and really not like them, it's a good idea to make an appointment with their pediatrician or family medicine physician. The other thing is that if your child's really more emotional, labile, their behaviors have changed, you're concerned for their safety or others, then they probably need to see someone sooner. And the Clarity Child Guidance Center has some great resources on their website. They have an in-person option 24/7. We have some things on our website at University Health if you need to contact somebody. And then you always have 911 if you really need somebody there right away because you're afraid for your child.
Anything else folks should know?
Yeah, so I think that COVID has brought with it a lot of opportunity for us to get back together as families. And so don't forget that kind of good old-fashioned communication is never too late to start things like family dinners, put the cell phone down. It can be hard, but really letting your child know that you love them no matter what and initiating those conversations is important.
All right, thank you so much for that information. Dr. Dina Tom, pediatric hospitalist with University Health and Associate Professor of Pediatrics with UT Health. We're going to get the information up on the screen. That's 210-358-4000 or visit universityhealthsystem.com/help for more information.